Hello, I'm Professor Hans-Michael Ockenfels, Chairman of the Department of Dermatology and Allergy of Klinikum Hanau. One of our main treatments is the photodynamic therapy of actinic keratosis. We performed a study of daylight photodynamic therapy with 132 patients with actinic keratosis on the face and on the scalp during a period of 11 months. We saw that after this time we had similar results with the new daylight therapy than with the traditional photodynamic therapy. This means that 80% of the patients healed completely and 20% become better. So after 1 year, also less actinic keratosis could be found in these patients. Okay. The difference between the traditional therapy is that we have a cabin with light which goes all over the patient, so that a face and a scalp is completely irradiated in only one session. This session has a duration of 1 hour and is totally or nearly totally painful. This is a very big difference to the traditional therapy. More than 50% of the patients told us that it's very, very painful. It starts after 3 minutes. It's like somebody scratches in the skin, and these we can't find in the new daylight therapy. Therefore, all patients of the study completed the study. There was no patient like a dropout, and all patients thought that this new therapy is very comfortable. First, the treatment of actinic keratosis is similar like to the traditional therapy. This means that the crust and scars has to be removed, that the light can really go directly in the involved skin. After we have the photosensibilizer, which is moved on the scalp or on the parts of the skin which we want to treat, they have to be 1 hour on the skin, and then we have the radiation also of 1 hour. We find similar results to the traditional therapy after 1 day. This means 20% of the patients get red skin or get a brown color. This shows that there is an inflammation process in the skin which destroys these skin cancer precursor cells. There are also patients who have only a less reaction but also good results. So it's an individual process. But after 1 week, all the color or all the crusts are removed, and the patient looks also a little younger because of the new skin which will be formed. The new daylight therapy has one big advantage, that it can be used every day. So it has to be called a controlled daylight, because when the people go outside after the cream, we don't know if it's good weather, if it's bad weather, which concentration of radiation is going on the skin. And this is also one point which is important. This daylight cabin is UV free, so we don't have the radiation with also UV light. This is only the radiation in the spectrum of the photosensibilizer, and there's no UV light, so it's a very controlled radiation. Our study showed that we have similar results to the traditional red light photodynamic therapy, but without pain and more comfortable to our patients.